Hi, my name is Stephanie Malone. I work over at Cardiac Rehab. I'm a registered nurse and a registered dietitian, and today I'm going to talk about blood pressure. So let's first talk about what blood pressure is. Simply put, it's the force of pressure against the artery walls. We look at two numbers when we look at the blood pressure. We look at the top number, which is called the systolic, and that's the pressure when your heart beats or contracts. And then we also look at the diastolic, and that's the pressure when your heart relaxes. An ideal blood pressure is anywhere below 120/80. High blood pressure would be considered around 130/80. High blood pressure, also called hypertension, unfortunately has no symptoms. So high blood pressure or hypertension can be silently and quietly damaging the inside of your artery walls over a period of time. And left unchecked, it can lead to stroke, vision loss, heart failure, heart attack, kidney disease or kidney failure, and sexual dysfunction. One of the ways you can take control of your blood pressure is by monitoring at home. What you want to do is get one that's automatic, so all you have to do is press a button. You'll want to get one that wraps around your arm, not your hand, your wrist, or your fingers. Those tend to be less precise. You'll want something that has a nice large display. So when you monitor your blood pressure at home, you'll want to avoid any caffeine or alcohol for at least a half an hour before you start. You'll want to sit down, relax, legs uncrossed, and your arm at heart level. You'll want to avoid any talking while you're taking your blood pressure. You press the button, take the blood pressure, and make sure that you're consistent using the same arm. After you take the blood pressure, keep the cuff on, wait a minute, and take it again. And what you'll want to do is take the average of those two numbers. If those numbers are very different, wait another minute, take a third blood pressure reading, and average the three.
My name's Ginny Dow. I'm a nurse and the manager of the Emerson Hospital Cardiac Rehab Program. And now that you've been measuring your blood pressure, and if you've been told it's a little too high, what are you going to do about it? So basically, you need to know that you are in control of your blood pressure. And the first thing you do when you're told your blood pressure is too high is start with lifestyle changes. The first lifestyle change that you can make is looking at your risk factors. So one of the risk factors for high blood pressure is smoking. And what happens with smoking is it constricts your blood vessels, so you don't smoke at all. Something else you should know is exercise dilates blood vessels. Meditation dilates blood vessels, but eating too much salt will make your blood pressure higher, because if you have too much salt, it causes you to retain fluid. Those lifestyle changes are important, but the number one lifestyle change you want to make is your diet. Lots of vegetables, lots of fruits, whole grains, quality proteins. Here's an example of a healthy lunch. And we're going to have another lecture specifically on food, but this shows lots of colors, and it's salad. This is an example of getting a lot of vegetables. So that's several servings in one meal. Another thing that is, again, a dietary change that's involved when I mention sodium is the fact that sodium levels are a common cause of high blood pressure, because people don't realize there's a lot of sneaky things in your diet that have salt. For instance, sodium is found very high in soups and cheese and deli meats and in pizza. The average American gets 3,500 milligrams of sodium a day. The recommended amount of sodium is 1,500. So again, make sure you try to keep your sodium level a day under 1,500. I love this one, exercise. People kind of think, well, why is exercise good for me? Well, guess what it does? It dilates your blood vessels. Exercise should make you feel happy, so do what you enjoy. Do swimming, biking, running, but guess what? Dancing is one of the best things. We call that exercise with joy. So exercise will lower your blood pressure. Keeping your weight down, and specifically keeping, we call it hazardous waste, is important for lowering your blood pressure. Every 2 pounds of weight loss will bring a 1-point drop in your blood pressure. And alcohol, some people think alcohol is really good for your heart, but in fact, too much alcohol actually raises blood pressure. So if you do drink, make sure you keep it to 1 drink a day if you're a woman, and 2 drinks a day if you're a man. So to summarize, try to lower your blood pressure with more and less. do more vegetables, less salt, more exercise, less alcohol, more vegetables. Oh, did I already say this? Get in those vegetables, and that will help you to lose weight. So hopefully this video has been helpful to help you to be in control of your blood pressure.